There's an identity crisis in global health. $850 million people all around the globe don't have any form of recognition whatsoever. That's no birth certificate, no national insurance or social security number. This makes them functionally invisible in the eyes of governments and the eyes of many of the systems that are there to protect them. With Simprints, our goal is to make sure that everyone, everywhere, no matter where they're born in the world, has access to digital IDs and life-saving healthcare.
Osiabura is a very typical Ghanaian rural community where everyone knows each other. You would find children playing football, volleyball, girls splitting their hair, children running around. It's a very, very lively community.
Osiabura is one of thousands of towns across Ghana and all over the world where Simprints is helping health workers accurately identify the patients and link them to the right medical records so that moms and dads can know their kids are staying healthy.
What's unique about the Simprints Arm partnership is that we're working to ensure our technology is specifically configured for the unique characteristics of a local population.
Using ARM compute power and AI, we're assembling a training dataset for machine learning that takes a really diverse cross-section of infants. We use existing smartphone and tablet cameras to be able to take a combination of the face, ear, and even the sole of their feet to predict how that infant will grow. So when the algorithm sees them again, say in 3 to 6 months' time, we're able to recognize them and link them back to that original health record. This is a tiny amount of software using really high energy efficient technology. That means it can literally reach the most remote communities all over the world. I think 10 years ago, this would have been science fiction. It wouldn't have been something that any team anywhere on the planet was able to do.
It can help us to know every history about that client, especially the children. When they come, we know their schedules. Yes, so we know that this particular child, this is what I'm supposed to give at this particular time.
When you have this near real-time data from multiple clinics, multiple sources all over the country, you can paint a really accurate map of coverage. Which kids have been vaccinated, which kids are potentially falling behind.
Simprints is a key partner for ARM because they are working with governments on how they can analyse that data and distribute their resources in a more efficient way.
We're working directly with the Ministry of Health in Ghana and many other countries to use this data to make sure that leaders and decision makers can see the big picture to close those coverage gaps. That can not only save a lot of lives, but in the process, reduce the cost of vaccine delivery around the world.
We're bringing accountability into the system. No child needs to die again from something that is entirely preventable.
Once every child can clearly be identified, I would consider that a great fulfillment.
I don't believe that technology is always the answer, but when it is, it can be transformative.
It's making the invisible visible.